So, first things first. Yes, the title of this video is 100% clickbait, and that's because there are so many myths and so much misunderstanding about PCOS that I really want to clarify a few points for you today. First of all, what is PCOS? So it stands for polycystic ovarian syndrome. In order to meet the diagnostic criteria, you need to have 2 out of the following 3, and they are absent or irregular periods, signs of excess male hormones, so androgens, and this can be things like acne, very oily skin, male pattern baldness, and in particular hirsutism, which is excess body hair. And the third thing is having polycystic ovaries on a scan. So you need to have 2 of those 3. So here are the top 10 things that I wish everyone knew about PCOS. The first thing is that having polycystic ovaries on a scan does not automatically mean that you have PCOS. Lots of people will be having scans for various reasons and being told that their ovaries look polycystic. This can be quite common without having the other 2 features that I mentioned, particularly if you're very young, you have lots of eggs and they're all busting to get out. Number 2, pain is not a classical feature. Some people may have pain related to their PCOS, but I often see people who say, I've got lower abdominal pain, but I've got PCOS, so that's why. That concerns me a little bit because it just makes me a little bit worried we might be looking past other possible diagnoses. So I would like to ask you a few other questions, thinking about other conditions. So for example, endometriosis springs to mind. And the other thing is something related to the bowel, because we have to remember that in the pelvis, there's lots of bowel as well as our humble little ovaries and our uterus. Number 3, it's not your fault. Lots of people often feel that they've got themselves to blame for the fact that they have PCOS. Now, I think this often relates to the fact that we talk about weight, and I think we can't ignore the statistics. So we know that PCOS is more common in women who are overweight or obese, but lots of people can still have it and be normal weight. Now, it's important to really say that, it's a genetic condition as well as environmental factors playing in. We don't 100% understand why it happens, but it's absolutely not your fault. Number 4, doctors don't intend to be fatphobic when talking about weight, but I do acknowledge that sometimes we're not always very good at getting this message across. One of the reasons why it's important that we do talk about weight is when we understand exactly how the disease arises. Now, we know that it's caused by having a degree of insulin resistance, so that's the hormone that regulates blood sugar, and also due to excess androgens, so things like testosterone. Now, to be very, very clear, from a science point of view, your fat tissue will increase your insulin resistance. So if you have lots of fat tissue, then it means that the body has to pump out more and more insulin so you can become more insulin resistant. Again, you don't have to be overweight or obese to have insulin resistance. But the other thing to say is that fat tissue is its own hormonal powerhouse. It makes its own hormones. So adipose tissue, that's fat tissue, can make testosterone. So that's why we do talk about weight, and we do know that in studies where women have lost between 5 and 10% of their body weight, they may actually have been able to regulate their periods and reduce their symptoms. But I do acknowledge we're not always the most sensitive people when it comes to talking about weight. If you're a healthcare professional and you want to improve the kind of dialogue that you have with your patients, I really, really strongly encourage you to check out London Centre for Intuitive Eating. They have a PCOS guide, and I would certainly say I think it's improved my ability to have these kind of conversations about diet and lifestyle with my patients. So number 5, diet and exercise can help your symptoms. And in all of the guidelines when it comes to PCOS around the world, they all state that the first line of treatment should be lifestyle modification. And we do know that in studies where people have, for example, used foods with a low glycemic index, they have been able to improve their symptoms, and also exercise as well has been shown to improve menstrual cycle regularity and also decrease the symptoms that people have of having too much testosterone. Number 6, not everybody can completely eliminate all of their symptoms and regulate their cycle with lifestyle changes. And I think that's so important to say, because again, I think it goes back to that blame thing. I think that often people have done absolutely everything they can and, have the best, most perfect textbook lifestyle and still have signs and symptoms of PCOS. So again, it's not your fault, but I think it's important to try and take some of these modifications on board. Number 7, there is nothing wrong with using the pill if you have PCOS. This is something that I see quite a lot written on the internet and on social media, but I think that we have to realize that the pill can be a very good way of improving symptoms, and there's nothing wrong with wanting to improve your symptoms. Certainly in terms of androgens, the pill has been shown to increase expression of a protein called sex hormone binding globulin, and this is something that mops up testosterone and decreases its potency. So the pill can help, for example, with acne and with hirsutism, so the body hair that I mentioned. Of course, it's not suitable for everyone, so talk to your GP or your doctor. The other thing is that it can help with having a regular bleed, but it's important to say that it won't reset your hormones. So if you start taking the pill and you don't change anything else about your lifestyle or the way in which you live your life, then most likely you are going to have the symptoms, the irregular menstrual cycle after you stop taking the pill. But it doesn't mean that it's wrong, and there's no shame in needing to treat symptoms. Number 8, not everyone is infertile. Now, if you Google PCOS, immediately Dr. Google tells you you're infertile. This is not true. I've seen lots of people who have been told by medical professionals, you have PCOS, you're never going to be able to get pregnant. They stop using contraception and, oh hi, you're pregnant. So you don't get pregnant as easily with PCOS if you're having irregular cycles, because you're unlikely to be ovulating regularly, releasing an egg every month, which is of course necessary to get pregnant. But if you are able to get a regular cycle or to, for example, use medication to ovulate, then it is possible, but not everybody needs fertility treatment. So a really nice study that was done in Sweden of people who had PCOS who tried to get pregnant showed that actually 2/3 of women got pregnant completely on their own without any medication or any kind of procedures or IVF. So I know that's not 100%, but I hope that figure will just maybe slightly comfort and reassure you that majority of people with PCOS are actually going to be able to conceive. If you're trying to get pregnant and you have PCOS and you try for 6 months and you don't successfully get pregnant, then I would like you to go and see your GP and discuss potential further investigations. But you still need to use contraception if you don't want to get pregnant. Number 9, ovulation kits with PCOS are unreliable. So the ovulation kits that you get in the pharmacy are little sticks that you pee on, and they look for a hormone called LH, so luteinizing hormone. LH is the signal that is sent out to the ovary to tell it, release an egg. There's a massive spike, and then about 36 hours later, you should ovulate. Now, if you don't have PCOS, they're reasonably reliable. It doesn't tell you that you've ovulated, but it tells you that the signal has been sent out. Now, the problem with PCOS is that lots of people actually have a higher baseline level of LH, and lots of people will actually have several LH spikes throughout the month. And so I think of LH as being like a pin that the body uses to try and pop that egg out of the ovary. But in PCOS, higher baseline rate, probably several different surges throughout the month. So you'll often get a positive result, but it doesn't mean that you've had that single spike that's going to release an egg. Number 10, it's a long-term condition and it's not just about fertility. So we do know that people who have PCOS have a higher risk of having type 2 diabetes and also heart disease in the future. So it's really important that you do discuss what kind of healthy lifestyle changes you're going to make to try and reduce the risk of that in the future. And there have been long-term studies that have shown that by making these lifestyle changes, you can actually decrease your risk, in particular of type 2 diabetes. So it's super, super important. Now, little bonus one, I know I said 10, but I'm going to give you 11. It does not increase your risk of ovarian cancer. There is a slightly higher risk of endometrial cancer in people with PCOS, because you don't always shed the lining very regularly. So for this reason, we say that we like you to have about 4 periods a year at least. So 1 period every season. That's a bit confusing if you live in the UK, because as you know, we can get 4 seasons in one day. But generally speaking, that's what we would like. So it is important that you do speak to your doctor to make sure that you are having a bleed approximately every 3 months or so. I hope you found that helpful. Please do share this with anybody who you know who has PCOS, because I do find that all of the things I've talked about cause quite a lot of worry and concern. I hope you've enjoyed it. See you soon. Bye.